When we look at readmissions, and there's been a lot of data studies throughout the country on why people do get readmitted to the hospitals, by far the biggest reason is something related to medications. And there's a couple of different things. One is patients need to understand what medications to take. They need to be able to afford the medications, and then they need to be able to physically access them. So we need to be sure we give patients a very clear picture of what they should be taking when they leave, which means we need to know what they were taking before they came in, so we can tell them not to take that when they go home if it's not on their new list. We need to keep all the changes that are happening during the hospital stay up to date, and then at the time of discharge, really look at the list of medications we're giving to be sure that it's clear and concise and makes sense to the patient. Maybe I was taking a simple diuretic like Lasix before I came in, but now the dose has changed. Being sure that that dosage is different now. Because when the patient gets home, they're going to see a bunch of bottles of pills here from before. They're going to have a bunch of bottles of pills here, and they're going to say, which one do I take? I forgot what they told me. So that list we give them has got to be their key. We literally give them a list. There's a thing in the hospital called medication reconciliation, and the nurse is responsible for doing it at the front door in the ED. The physicians do it in the emergency department, the inpatient doctors do it, and nurses, and then the discharging doctor does the final list. And they just keep taking the same list and updating it and double checking it to be sure that at the time of discharge, that is a clear picture of what the patient needs.